Okay, well, again, thanks to everyone for joining us today. We are very much looking forward to World Health Assembly coming up in another couple of weeks. And hopefully this will be a fruitful discussion for old-timers and newcomers alike. We wanted to first of all welcome you and go over our usual logistics for these webinars. As usual, you can submit questions or comments in the chat box on your right and ensure that you're including your name and your organization, and we'll be sure to keep track of those as we go along. But as for the agenda for today, that's essentially us really reviewing, first of all, the list of delegates that we have for WHA, so everyone has a sense of going, in addition to providing another overview of our site events. We'll also get into some key communications and talking points specifically for the GHG delegation and for anyone else who's interested, frankly. And then finally, we have a guest speaker today. One of our GHG members and delegates will be offering some tips and tricks for first-time delegates. So again, just a sense of WHA and a review of where things stand as of our last webinar, some key information for our delegation, and then finally any questions that people have who are going for the first time. We want to allow some time for that in the last half hour or so. So with that, let's dive right into the discussion today. As usual, we want to be sure everyone has a sense of GHG, why we exist, what we do, and so these are some general talking points for everyone who's joined us today. Again, we're a membership organization. We represent a number of organizations across the spectrum and across sectors, and we're very happy to annually host a delegation to the World Health Assembly that represents our broad range of partners. So welcome to this wonderful community, and thank you for being a part of it. As for what we've been doing leading up to WHA, we have, as I've mentioned, had a couple of other scrums this year. If anyone has missed those and wants to take a look back on what we've discussed, those have been recorded, and those presentations and notes have been archived at our webpage on WHA. We also, in addition to the scrums, have been able to engage with the Office of Global Affairs at HHS, which leads the U.S. delegation to WHA. Just last week, we joined a number of our other members in offering statements at a listening session on May 5th. And we specifically offered a statement on the framework with non-state actors. I know a number of our other members offered additional comments, and Danielle can share more around that. And then finally, we have been able to host candidates for the position of Director General, and that's been very exciting for GHC to do, to invite some of our members to be a part of these small group discussions with the various candidates for that position in an effort to understand their priorities for that role and how we could further inform their platforms. So that's what we've done leading up to today. As far as who we are, I think most folks know, but for people who don't, again, I'm Lois, and then I will be joined in Geneva by our small, mighty team, Danielle and Liz, who are here to serve you and whatever you need on the ground in Geneva. If you will be able to see us and meet us in person at the welcome reception that we're hosting, but otherwise just be on the lookout for us on the ground there, and we'll be able to kind of help guide you and connect you with other delegates accordingly. As for the delegation, we are close to 70 members of our delegation, and we've been holding steady at that number for the past couple of years. We have a number of organizations that are represented, again, some that have been coming with us for a while and others who are newer, and so we're really excited to, again, represent a wide range of stakeholders as part of this group. One thing that we did a little differently this year is we really focused also on this group of GHG advocates. And we are extremely grateful to people who have signed up to be a part of that pool as well. That's a group that's not necessarily a part of our formal delegation. However, we are closely partnering with them on events and perhaps other side meetings throughout the week. And that's partly due to some new guidance that WHO is working on in terms of its engagement with non-state actors. So I think that these categories and our engagement overall is ever evolving and will remain fluid. I think we look forward to seeing how that evolves under new leadership. But suffice to say, we at GHC are committed to ensuring that our presence at WHA, whether formal or informal, really reflects a wide range of groups and partners. So again, thanks to all of you who have signed up to be a part of our contingent, and I hope you enjoy your time there. In terms of what's happening at the 70th World Health Assembly, things kick off on Monday, the 22nd, and run all the way through that week until after the U.S. Memorial Day holiday. Essentially, if you are able to access the agenda, you'll see that most business formally is scheduled from about 9 to 5 with a break in midday for lunch and essentially side events and meetings. There are also a number of formal events that happened at the Palais des Nations, often during the lunch hour, but also in the evening or in the morning, in addition to a number of other what are called side events that take place at the Intercontinental or other sites near the Palais. Logistically, just remember to have your badge with you at all times, whether you're a GHC delegate or otherwise, if you want to have access to the Palais, and you'll have to have that badge visible at all times during that week while you're on the grounds. So for those of you without a badge, as I mentioned, there are a number of side events that take place, which are generally open to whoever wants to attend them. This is just a snapshot of the side events that Global Health Council is co-sponsoring with other members or partners. First off, we're proud to be partnering again with Women in Global Health on their Women's Leadership in Global Health events on Sunday. It's a Heroines of Health event that proves to be that should prove to be really exciting, and we're very much looking forward to that. We're happy that some of you will be able to join that event that Sunday. We also will be hosting a few more public events throughout the week, mainly Monday and Tuesday. First off, we'll be hosting an event on global health security from a women's standpoint, and this follows on some dialogue I think we had around this subject area at the last World Health Assembly. We also have an event that we are hosting on Tuesday around priorities for the next WHOGG, and we have confirmation from HHS that Secretary Price should be able to join us for that, and so that should be well attended, and we're hopeful that those in this session will be able to be a part of that discussion. Our goal at the end of that session will be to develop and even present a set of recommendations from civil society for whoever the new leader or director general of WHO will be. And this is intended to be aligned with the vote taking place that day. Also on Tuesday, we're co-hosting an event that's specifically on women and children's health and fragile states or complex settings. And then finally on Wednesday morning, we have another invitation-only event that we're hoping will be a high-level discussion with stakeholders around sort of the new normal for global health and global health financing. We've extended this special invitation to each of our delegates and advocates, and so we're very hopeful that people will be able to join us that morning. Space is limited, so we are asking each of you to register only one per organization, but we're hopeful that we will have a critical mass of delegates and partners in the room that again reflects our broad membership, and have some fruitful conversation about kind of what we do next given the shifting political and funding landscape in global health around the world and particularly this year. Just a little bit more on side events. We will not go through the exhaustive list of side events, but we are grateful to those of you who've been sending those our way through events@globalhealth.org. If you do have other invitations that you don't see reflected on our special webpage, you can go ahead and forward those to us. We'll be releasing another flash events news flash in advance of WHA, just so people kind of have all of those in one place. But our goal has been to compile all of those various activities so that our members and partners and others have easy access to those and kind of understand where to be when. I think now we're going to go ahead and shift into a discussion on communications, and then I'll come back a little bit later to talk more about some specific talking points we have. Thanks very much.
Great, thanks so much, Lois. So this is Liz Colway. As mentioned before, I'm the Communications Manager and Member Engagement Manager at GHC. And I just wanted to share with you a little bit about what GHC is preparing for WHA. So we're actually right now working on a social media guide that will be sent around to our delegates and advocates about middle of next week. We're also going to be doing social media alerts during the week, specifically from Sunday to Thursday, where when we know that the bulk of our delegates will be at WHA. Some of our main themes include sort of this orientation to WHA on Sunday, on Monday focusing on global health security, on Tuesday focusing on the priorities of the next WHO Director General, health system strengthening on Wednesday, and then on Thursday looking at these crucial conversations and what's next. So please do engage with us both on Facebook and Twitter, and you'll see our Twitter handle at the bottom of this slide. So we're also excited to share takeaways from our delegates and advocates, and we invite you to essentially be our eyes and ears during these critical conversations. So we have a link to our blog guidelines, and you're encouraged to submit blogs to us throughout the week and then right after WHA. We also are putting together a Storify, so if you are able to take some photos at various side events and proceedings, please do send them to events@globalhealth.org. We're also asking, since blogs are a little bit of a big ask during this busy week, if you do have bullet points from agenda items that you're following that you can share with us each day, we will try to include those in some of our daily alerts and takeaways.
So getting back to just some general guidance for GHC delegates, and thanks Liz for running through our comms plan for the week. We thought it would also be helpful for people to hear, just have a better sense of how they could speak to the work of the Global Health Council and really represent us. And so one of the things I want to emphasize right now is the fact that, you know, we really are seeing this as sort of a Global Health Council contingent, and while we recognize everyone represents a different organization in his or her own right, it's really important to us that everyone feels as though we're part of one GHC, and so we recognize that we need to equip you with the tools to best represent Global Health Council, who we are and what we do. So hopefully this section of our discussion will help us achieve that goal and help you be good spokespeople on our behalf. I will say that we've actually we've been very thoughtful in previous years, but especially this year, about really inviting people to join the delegation who are committed to GHC. So this is not just about access to the Palais, but it's really about people who want to work in partnership with the Global Health Council on our various priorities and activities. And so each of you is really looked at as a key player in this space and a key partner of ours, and I hope that you see us the same way. It's also very important, honestly, for you all to understand our motivations and our thinking behind the delegation, because you might be asked by WHO staff or member states about your involvement with Global Health Council, and so we want each of you to be prepared to speak to that as to why you're on the delegation and again the role that GHC plays with your organization. So I hope that that's clear to folks. One thing we wanted to include as part of your, I guess, packet of talking points is our latest version of the strategic roadmap. We sort of quietly rolled this out a couple of months ago, but it's essentially an update of something that we had that spanned the years 2014 to 2016. And so we have an updated version that takes us all the way up to 2020. And essentially our mission, vision, and principles are the same, but what you'll find on the second page are really some key points with regards to our aims working up to 2020 and really how we plan to how we hope to be successful in that right. So you've heard a lot of this before, and a lot of our communications at various events or online. Again, we really believe in fostering consensus across the global health community, really getting to the finish line with some key global health goals, and essentially fighting for global health funding, for support for our work, for policies that make sense, et cetera. So we want everyone to feel fluent in those talking points. If you do have questions, feel free to direct them to us either before we get to Geneva or on site. We can help you through them, but hopefully they're simple enough to grasp. And again, it just gives everyone the same foundation from which we can talk about the work that we do. With regards to submitting statements, following on that, we know that WHO also sees us all as one delegation, and so just a reminder that any statements that you submit will be vetted by GHC, and we want to be sure that does align with our mission statement and our core objectives. We've never had this problem previously, but it's something we like to reiterate. Also, you need to be sure to actually mention Global Health Council and the fact that you're making a statement on behalf of GHC as well as your own organization as part of the statement. And so if that's not there, we'll have to include that. And so just so everyone's clear, that's something that's a requirement of WHO. And again, in an effort to really see us all as one core group. With regards to actually submitting those statements, you'll find the guidelines online. Again, we've included a link in the slide here. The deadline is about a week from today or so, the 18th. So you'll want to be working on those and get those in as soon as possible. Of course, we do our best to keep track of when things will be timed, and I think WHO tries to notify us when we're sort of on deck. But for people who have gone to WHA previously, you know that it's sort of a moving target, and so the GHC staff will be on hand through Saturday. So we'll be on hand that full week. In the event that statements need to be read after that day, you'll definitely need to be sure that you have someone on hand to read those statements.
And I just wanted to add one other note. I do recognize, or we do recognize, that there are possibly multiple statements on the same agenda item. So if that situation does occur, we will be in contact with the multiple organizations that have submitted statements to try to combine forces, because we can only submit one statement per agenda item.
That's a really good point, Liz. Thank you. And all the more reason to really take a look at our delegate list and really understand sort of who's going to be on GHC's delegation. So that way you can possibly coordinate before you draft a statement with another group on how that reads. And then that way we won't have to sort of reach out to both of you or do our own editing on our end. So thanks very much for that clarification, Liz. If people have other questions about statements or anything else I've mentioned so far, again, just want to remind you that the chat box is there for you, and we are keeping track of any questions or comments there. Just some other important notes to keep in mind, and this really lends itself to coordinating. We do have a Google group that we do use, and so if you haven't received an invite to that group, definitely let us know, because we want to be sure people are getting our communique throughout the week. We find it's very useful in terms of sharing any sort of kind of news flashes about what's happening. if people are seeking partners for specific meetings or seeking intel, we really plan on using this Google group, or even as a tool for, as Liz said, collecting bullet points for our daily briefings or blogs, which I know we'll get into in another minute here. In terms of your credentials, be sure you have that letter with you, just because it's always safe to have it. And, while we did register everyone who had applied and had been approved and ensure that it was in WHO's system, things can go wrong. And so just be sure you have that on you as a backup. And then finally, again, we do have our website, and a lot of this information is there, so be sure you access that, flag it, whatever you need to do to keep track of things going on that week.
Great, and just a few other important notes that we wanted to make. One being that this year we are proposing to hold a few delegate briefings, specifically Monday through Thursday, again, when the bulk of our delegates will be in attendance. We will be sending out a poll to gauge interest, both in availability and then also in a couple of possible locations, all again centered around the Palais. So please do check. We will be sending that poll out through the listserv in the next few days. So if you could respond, it would be much appreciated. Also, we ask that if you do have any specific intel to share from any of your side meetings, to email our advocacy manager, Daniel Heiberg, at advocacy@globalhealth.org. And then a final note is that the 141st session of the WHO Executive Board will meet right after the WHA, June 1st and 2nd. It is open for delegates, so if you are sticking around or are based out of Geneva and would like to attend, please let us know, and we will make sure that you are registered. And it's a similar process to WHA in that you have to have a credential in order to get into the grounds. So if you are a WHA delegate and are looking to pick up your badge, you will have two opportunities to do that. One being at our welcome salon or welcome reception that we'll host on Sunday from 2 to 4. And that's right before the new delegate briefing will take place. So you can pick up your badge there. You can also pick up badges of colleagues or friends. Just be sure to sign up and indicate who you're picking up a badge for. And then I'll also be at the Intercon on Monday morning, which is close to the Palais, and you can pick up your badge there. If for some reason you arrive after those dates or are unavailable to pick up your badge, I will be returning them right after Monday morning to WHO headquarters. So you can just proceed to the front desk and pick up your badge then. And again, just make sure that you have your letter of credentials on hand in case they ask. Great, and now I'm going to turn over the presentation to one of GHC's delegates on this year's WHA delegation, Dr. Inan Shaker, who's the Senior Director at Teva Pharmaceutical Industries, and he leads their corporate global public health program. He was a scientist with WHO in Geneva and an individual member on several GHC delegations to WHA in recent years.
Thank you, Lois. Thank you, Liz, very much. Indeed, the World Health Assembly is the most important global public health event this year, not only because of the election of a new Director General for WHO, but also because of the themes on the agenda, as well as the more global politics that are involved with funding and focus of the international organizations that deal with health. So there is really no other convention of all nations, ministers of health and their senior technical staff and diplomats and NGO leaders and public health experts and media that are condensed in one palace in a week time. What I'll try to do in the next couple of minutes is to assist new delegates in preparations based on my experience as a GHC delegate in past delegations, give you some helpful tips, because I really think that in order to get the best out of the WHA, being strategic seems to be quite important. Let me just pause for a minute and ask if I'm well heard, because I'm speaking to you from Jerusalem.
Yes, we can hear you. I'm just, right now my screen is frozen, so I'm not able to advance the slides on my end.
Okay,
Hold on
should
one
we
second.
wait for you a minute?
Yes, that would be great. Great, you should be able to present now.
Thank you. So on this slide, actually, we could see an invitation to a 3 hours session, which I actually highly recommend for new delegates. It's really organized by experts, both on the United Nations and global health. And obviously here in this short intervention, we could not cover everything that they will share with new delegates there. So highly recommended. But I'm also happy at the end of a short presentation that you'll see in the next couple of slides to also answer any specific questions for those on the call as necessary. So if we move Lise to the next slide, you will actually see a map of the Palais des Nations. This is the UN Palace in Geneva, nothing like the United Nations, well known to most of us in New York. And this is really where there is going to be never a dull moment between the 22nd and the 26th of May. I would like to ask you to note a few big letters. They're actually quite visible on this slide, but you could also be guided to the PDF in front of you. So please pay attention to the big letter A in the middle. That is the Assembly Hall building. And on Monday, you should try to be there not later than maybe 1:15 p.m. Actually, many people think that because the indication of the beginning of the assembly is at 9:30 in the morning, then that is the time to be there. Well, I would recommend otherwise. Usually the morning session is very technical, procedural, many would say even boring. So the real action really begins on Monday at 2:30 with the address of the DG. This is still Dr. Margaret Chan. And in order to be inside the special floor designated for non-governmental organizations and similar to the GHC delegation, you would want to be there early enough to take your place. It's first come, first served, and there are not too many seats available. Because internet is free and available there, then that might keep you occupied while waiting for the beginning of this very, very impressive session, even maybe more impressive this year than other years. The working hours, by the way, of the plenary at the World Health Assembly, and remember this is Switzerland, are 9 to 12 noon. The exception is on 9:30 beginning, as I've said, on the Monday, but all other days it's from 9 to noon, and 2:30 to 5:30 p.m. This actually leaves the lunchtime, a lengthy lunchtime of more than 2 hours, for technical briefs for the various side events that are happening outside of the Palais. Once past security, I suggest you head down to stairs that lead to gate A15. You may note again next to the letter A on the right side, on my screen at least, the letter A15. This is the best entrance to the building. And in that short corridor, you'll find an opportunity to pick up the WHA free documents if you need the printed copies. But as we have learned just a short while ago on this presentation, on this webinar, all is really available online. There is a very small coffee place there in this very condensed building, and you will immediately notice the colorful mix of delegates from many countries, almost 200 countries, and many of them come in their national costumes. So that's where you'll be maybe able to take your first photograph for your blog or tweet or Instagram. If we further look into the A building, you'll notice the letters B and C. The corridors on the third floor, and the third floor is important to remember as we are mapping the place where most events are happening, because that's the connecting floor among all of the Palais buildings, as you'll notice. So the corridors to building B, which is the library, and building C would host a variety of exhibitions that will demonstrate the achievements of WHO over the past year, as well as some very key themes of the SDGs that have been just adopted a year ago. And this is an opportunity to interact with WHO staff members to learn more about your areas of interest. They are there exactly for that. You'll notice that there is a lot of excitement during the first day or two, and then you may skip those 2 days, and if you are really interested to engage with staffers of WHO also for an exposition or in terms of their own availability to deep dive into the areas of their expertise, you may want to postpone that for the later days of the week. There should be still lots of materials that they'll be handing out also on the later days. Pointing to the library building B now, you could notice a corridor connecting to the building E, which is on the far right side of the screen. And this building with the Latin numbers of rooms 19 and 20 is actually where the two committees, A and B, of the World Health Assembly will be conducting their business. So we have the plenary at the main building, the assembly, and we have then the technical and public health aspects being dealt with and discussed at Committee A, and the more staffing, financial, more internal WHO business discussed at Committee B. So this distinction allows you clearly to see where you'd want to be present. Again, space is limited, and to come just 10 or 15 minutes before the beginning of the session may not be sufficient. I actually believe that in building E, on the very bottom floor, where also there is the serpent bar, one could find you and us over 50% of the time during the assembly. This is really the meeting place for NGOs, for experts, those that are not allowed because of the different badges to be at the members states delegations zones, and there are such restricted zones. For example, the main floor of the assembly where only member state delegates could enter. So some tips already on this note when you are needing some food or beverages or other things to buy, use Swiss cash currency. In some places, credit cards could be used, but if you don't want to stay in line to see that the line behind you is pressing you to move on, small Swiss cash currency will be very helpful. Be prepared for long walks. There is no mile indication on the map that you are seeing, but it's long walks, and often you need to move back and forth depending on your interest from these three key buildings, A, B, and C. Also important to note is that security is tighter than ever before this year, and it means that there are long queues in entering the Palais des Nations during morning times, but also when you return from the side events, whether you're moving to a side event at the Red Cross Museum across the road or to the restaurant on the left side of the main entrance to the Palais or elsewhere, just be prepared and know that in calculating your time, probably half an hour or 40 minutes might be needed when you are coming back into the Palais from your lunch activities. Exiting the Palais is very swift and fast. It's the re-entering that needs to be taken care of. The next slide, if we can move further, Liz, is a print screen of some of the key documents of the World Health Assembly. I often try to actually read the documents that are of interest to my specific area of interest, and to do that with two types of binoculars. One is to get the most updated information, statistics, epidemiology, key discussion issues. These documents, which are available to the delegates, are really the premises, the background, which they are basing their debates and their discussions thereafter. And the other type of binoculars is basically to sense where is the agenda moving forward in terms of which items, for example, have been included, which items are not on the general agenda of the WHA this year. And this can teach us a lot about what I would call global public health diplomacy. You will see that there are two types of documents highlighted here. One is called the main documents, and maybe if we can move to the next slide, you'll see an example of that, which I basically chose randomly. It's an area that I'm interested in, which is antimicrobial resistance, or AMR. And you can see that this document has a date. That is the last date it has been updated, so it's actually quite relevant. And by the notion of the title report to the Secretariat, it is a way for us to know that this document is well condensed, small letters, yet very informative on the topic of antimicrobial resistance, up-to-date information, the key stakeholders playing a role, and obviously what WHO has done in this area. And such documents exist for every agenda item on the WHA agenda. Again, one can pick the printed materials at Building A at this entry corridor of gate A15. Actually, if you walk to the left, there are people who could help you. Maybe worthwhile to mention that these documents are in existence with the in the 6 languages of the United Nations, so it's English and French, Spanish, Chinese, Russian, and Arabic. And if your constituency or organization would need the information in those languages, you don't really need to translate. It's all coming well translated to us, either online or in print. The other type of a document, which is on the next slide, is the journal. Now, both are helpful. The other point I may make here regarding the key background documents is that these are really great informative materials for blogs, tweets from Geneva, and also for other communications, as we have heard from Lois, the intention for us to be active and effective there as well. So the journal is a way for us to know any changes in the schedule of the WHA and the briefs. Usually they are very minor. There is a way for us to access the journal online, and I suggest actually doing that just before you go to sleep, so you'll see the next day's changes, which could be actually quite important as you calculate your walks, time of entry, re-entry, and going in the pace that you have decided for yourself regarding the agenda. The last slide is actually about to move us back to Lois and to Liz, but I am happy to conclude by suggesting that actually Survive and Thrive could be easily adapted to the WHA context. It's really hard work, yet there is really no other global health event that could be compared to the World Health Assembly, and the opportunity that is offered to us to be part of a one delegation by GHC is something to be appreciated, to keep in mind, because it is really a very worthwhile participation that connects individual interests and organizational interests with the organization that allows this platform to actually come into a reality. So I'll stop here and definitely happy to answer any questions. Back to you, Lois and Liz.
Great, thank you so much. Those are really helpful tips, and hopefully folks on the phone can take advantage of them during their when they get to WHA. So just a few more slides on logistics. We've gone over a few of these things already. I just wanted to point out that some sessions will actually be live streamed. Mainly the first plenary, where I know a lot of people do try to get in the door, which is usually pretty hard. So if you're not there in person, it's definitely available online. And then some other sessions, committee sessions, may be streamed. Again, where you find all that documentation is where you would find links to the live stream sessions. And again, just a few other quick tips. You are allowed to bring laptops and cell phones and cameras into the Palais, but as noted previously, you do have to pass through security, so just be prepared to do that. And then also just a few other things that you might want to bring with you: an umbrella. Sometimes you get rainy weather in May in Geneva. Layers, a power strip is always very helpful. The cafe gets very, very crowded, so if you want to take advantage of the few outlets that are there and perhaps share with others, a power strip is definitely advised. And then also converters as well. And then we've also compiled a short PDF document on things to know before you go, which includes some of the tips that we've already talked about, and then also includes areas and restaurants and meeting places outside of the Palais that might be helpful as you gather with other delegates and colleagues throughout the week. And there's also a Google map of some of these spots so that you can actually plan on how to get there via transportation or walking. At this point, we'll take any questions. I know there are a few that have come through the chat box, so I'll just pause for a minute or two to let everyone type out their questions. Great, so we have just a few additional tips from some of our delegates. One, to bring comfortable shoes. As noted, you will be probably walking quite a bit throughout the week. And also a refillable water bottle would be useful. And if you would like to sign up to be part of the GHC Delegate and Navigate listserv, you can email events@globalhealth.org and we'll make sure that we add you to the list. And I know we haven't really talked about others' events and possible statements to be included, to be presented to WHA. But you can also start those conversations through our listserv, since we don't have a whole lot of time today, and you're encouraged to do so.
Okay, so barring any other questions immediately, we wanted to actually provide an opportunity for people to weigh in now with any other information they have on their events or statements that they plan on submitting. We did actually schedule this up until 1:30, so to the extent people are available for the next half an hour, we welcome having that conversation. Otherwise, we're happy to end a little bit earlier, but we wanted to open the floor to you. And just a reminder, if you do want to chime in, you can use the raising of hand option you should have on the chat box or send a note individually to Liz. Thanks. All right, well, I think that means you all want to get some time back on your day, which is absolutely fine. We want to thank you guys again for attending this session. As Liz has said, definitely send us emails at events@globalhealth.org if you have other questions or comments. And also, as she mentioned, please do take advantage of the listserv. We had a couple of people at least send us notices about planning to submit statements and then I think had to drop off of the webinar, but we will be encouraging them as we encourage each of you to start to post those messages on that listserv so that other people can take note of the issues you're tracking, how you're weighing in, the intel you're gathering, and otherwise really use this delegation to your advantage. Again, it's not just about a pass, it's about how we can coordinate and really harness the power of our truly collective voice. So with that, I want to thank Liz, obviously, for running this series. She thinks she does a great job pulling it together. I want to thank Anand especially for being our guest speaker today. I think it was a wonderful rundown he gave of what to expect at WHA, and it's a tradition that we have to ask our membership to come in and provide that information. Obviously, I want to thank the rest of the GHC team who are going to serve as backup that week from comms to advocacy and otherwise. And finally, thank all of you for being a part of this. So we will see you in a couple of weeks. Appreciate those of you who will join the delegation, but others who won't be on our delegation, please stop and say hello, and looking forward to following up after WHA.